Hi guys, and welcome to our KFQ revision part 2. So let's continue with today's lesson. Okay, so let's read today's question. A 44-year-old female presented to the emergency department after eating seafood, complaining of severe itchiness associated with shortness of breath, chest pain, and dizziness. On examination, her face appeared flushed, lips swollen, with generalized urticaria noted. Her vital signs were blood pressure 85/50, right? Heart rate is 120, temperature 37.8, respiratory rate is 26 per minute, SpO2 91% under room air. Lung examination revealed generalized bronchi with reduced breath sounds bilaterally. So please take a moment and read this question and organize your thoughts. We have 10 minutes to answer this KFQ question. Okay, so what is your provisional diagnosis? 2 marks. So please take a moment, okay, pause and answer. Okay, so the answer to this question is anaphylactic shock. If you answer anaphylaxis, it is not correct because this patient also she's having anaphylaxis evidenced by involvement of skin and lungs. So it is fulfilled as anaphylaxis, but at the same time she's also in shock. So we must pick up because the management is different if it's anaphylaxis or anaphylactic shock. All right, anaphylactic shock, the management is more aggressive. So the correct diagnosis will be anaphylactic shock. If it's anaphylaxis, 0 marks. Okay, let's move to the next part of the question. Okay, so this part, select 4 pathophysiological process to explain the above condition, 4 marks from the selection menu. So this is the selection menu. Please choose 4. Okay, select 4 answers. You may pause the video and choose your answers now. Okay, so now we are back and let's look into the pathophysiological process of anaphylaxis. But before even we look at the selection menu, let me just briefly explain what happens in anaphylaxis. Okay, some people react differently to certain allergens. Okay, what allergens are we talking about? We're talking about dust mites, seafood. Some people, just as in real life, you talk to some people, they get triggered very easily as compared to other people, right? Okay, so that's how our bodies, some bodies are very easily triggered compared to some bodies. Okay, triggered to what? Triggered to stimuli such as allergens such as dust mites, cold, seafood, peanuts. Okay, so what happens? So in a person's body that is not tolerant to this kind of allergens, what happens is that when the allergen enters, okay, in the body, it affects 2 areas of the body. One is in the lungs and one is in the circulation. In the lungs, the cells responsible are the mast cells. Okay, in the circulation, the cells that are involved are the basophils. Okay, so what happens is that the moment basophils in the blood or mast cells in the lungs encounter a foreign body which they don't like, okay, a foreign body or allergen, what happens is that in these cells, outside the cells, they have antennas, and these antennas are known as IgE, antibody antennas. Okay, so these antennas are attached outside of the cells, and what happens is that the moment they meet something they don't like, they will cross link and they will secrete. The basophils and the mast cells will break, will explode and secrete the contents into the surrounding area. What do they secrete? They secrete histamine and they secrete heparin. Okay, heparin, especially in the blood, is just to prevent clotting. Okay, we don't need to discuss that so much, but we need to understand the role of histamine. So what histamine does here is that histamine is the one that is going to mediate the immune system to remove these allergens. But at the same time, what histamine does, okay, in the lungs, histamine will stimulate the smooth muscle contraction of the lungs. That is why patients will come complaining of rhonchi and wheezing because the airways close shut, right? At the same time, it also causes angioedema. So with angioedema, and because of that, the blood vessels are all swollen, edematous, and that is why together with the smooth muscle contraction and the edema, patients with anaphylaxis, especially if it involves the lungs, find it difficult to breathe. Okay. In the circulation, what happens is that when basophils meet something they don't like, they cross-link, the IgE antennas cross-link and release histamine. Histamine causes vasodilatation of the peripheral vessels. So as you can guess, blood now starts getting trapped in the peripheral circulation. Okay, blood starts getting trapped in the peripheral circulation, and not only that, it also causes the smooth muscles, the endothelial cells, to it causes more junction between the endothelial cells. So what happens is that the endothelial cells become leaky, and there will be fluid will start moving into the third space. How much fluid? Sometimes up to 30% of a circulating body volume can leak into the third space because of histamine causing the gap junctions to widen and cause fluid to leave the system. That is why in anaphylaxis, especially in the peripheral, when it involves the peripheral circulation, blood gets trapped in the peripheries and there is leaking of fluid into the third space, which causes reduced blood to go back to the heart. Hence, the heart has reduced venous return, reduced blood to be pumped, hence the circulation goes into the shock. Why? Because cardiovascular, the heart has got not enough fluid to pump to the rest of the body. So that is why in this kind of case, we call it as a distributive shock. Okay, distributive shock, because blood is trapped in the periphery and is unable to come back to the heart. And at the same time, there's leaking of fluid, at least 30% of fluid leaking into the peripheral vessels. Into the third space through the peripheral vessels. So now, let's see the choice of answers. Okay, third space fluid loss is correct. Okay, but it is not the important pathophysiology process. Meaning that from the beginning, what happens to trigger it? Third space fluid loss is a consequence of the pathophysiology. All right. So third space fluid loss is correct, but remember when you choose your answers for your KFQ, you have to choose 4 that is the closest and the best related to anaphylaxis. Okay, third space fluid loss. There's so many other causes of third space fluid loss. All right, so it is not the definite pathophysiological process in anaphylactic shock. It's a consequence, yes, but not the definite process of anaphylaxis. Okay, so this is where some students may have gotten the answer wrong. Activation of the complement system. The complement system activation, which is your C proteins breaking down, this is actually your infection. It is a reaction towards infection. Organism comes in, okay, and then your antibody attaches to the organism, and then you have C proteins coming, attaching to your antibodies, creating this complement cascade activation. And what they do is this complement cascade activation creates a hole within the antigen so that fluid enters in and the antigen ruptures. All right, it is part of the infection pathophysiology, not anaphylaxis. Okay, or anaphylactic shock. Activation of macrophage, also not related. It is really more in infection. Okay, how your macrophage engulfs an antigen, gets activated and presents the antigen to the adaptive immune system, which is the T cells and the B cells. Not related in anaphylaxis. Okay, formation of antigen antibody complex is also infection. Okay, when you have an antigen, all right, the antibody comes and attaches itself to the antigen to mark this antigen to the whole body that this antigen has to be killed, and your immune system acts upon it. Not related with anaphylaxis. Histamine mediated myocardial depression is wrong. Okay, why? Because histamine's effect is on the peripheral vessels. It causes leakiness of the capillaries. Okay, it causes vasodilatation. All right, so it has got nothing to do with the heart. What depresses the heart is actually lactate. When there is hypovolemic shock, for example, and then your cells start converting from aerobic metabolism to anaerobic metabolism, your cells start producing more lactate. This lactate can cause myocardial depression, but not histamine itself. Okay, IgE mediated hypersensitivity is correct. Okay, because for allergic reaction, mast cells and basophils, they have IgE antennas, and these are the IgE antennas that actually triggers hypersensitivity. All right. IgG mediated reaction. IgG and IgM are antibodies in your bloodstream, okay, which are there to fight infection. So it's definitely not the correct antibody that is involved in anaphylaxis. In anaphylaxis, it is IgE. Increased vascular permeability, yes, okay. Because of the loosening of the gap junctions, the endothelial cells all become further apart and becomes very leaky. And this is stimulated by the action of histamine, okay. And remember, the action of histamine here is not just for H1 receptor, but also H2 receptors. Okay, So which means H1 receptors is abundant in the blood. Okay, so it acts on the H1 receptors, blood vessels, and also it acts on the H2 receptors, which is in your gut. All right. That is why anaphylaxis, there are 4 important systems that are involved: skin, lung, heart, okay, cardiovascular, and your respiratory. Okay, so on skin it causes hives, urticaria, rash, itchiness, and all that. Lungs, it causes bronchoconstriction, bronchi, okay, wheeze, okay. In your GI, via H2 receptors, it causes diarrhea, vomiting, nausea, okay. And number 4, your wait, what do we cover this now? The skin, all right, lungs, and cardiovascular. Okay, cardiovascular. In cardiovascular, what happens is that there is trapping of blood in the peripheral vessels, so there's not enough blood coming back to the heart, causing the heart's cardiac output to drop, to go into shock, distributive shock. So these are the 4 major systems that is usually affected by when patient has anaphylaxis. Okay, all right. Mediator release from mast cells and basophils is correct. Okay, what mediators we're talking about here? Because from the mast cells cross-link and release the content, the IgE cross-links, and the mediators that are released are histamine and also heparin. Release of cytokines is false, because cytokines are released from your T cells and B cells, which are the adaptive immune system, and they release cytokines. Cytokines will act on the antigen and destroy the antigens. Okay. Smooth muscle spasm contraction, correct, in the lungs. Okay, in the lungs it causes smooth muscle contraction as because of the histamine. Okay. T cell mediated histamine release is wrong. It is actually not T cell mediated histamine release, but it is actually IgE. Okay, IgE mediated histamine release. All right. Okay, so the next question is select 4 appropriate immediate management for this patient. Okay, from your selection menu. Okay, so please choose 4 management from this selective menu. Okay, pause, choose your answers, and let's resume after you have selected your answers. Okay, now, so before we go into the answering this question, remember that the question asked for immediate management, meaning that how will you resusc and stabilize this patient? According to the principles of management, you have 5 principles of management. It always starts with number 1, resuscitation and stabilization of the patient. We will make a video soon on the principles of management and how do we manage our patients. Okay, but first, before that, how do we classify anaphylaxis according to the World Allergic Organization criteria, the WAO criteria? So, according to the WAO criteria, in anaphylaxis, it involves 4 major systems, which is your cardiovascular, skin, GI, your gastrointestinal system, your GI system, and your lungs. Okay. So first is always the skin first. All right. So you may have skin, hives, urticaria, rash. If it's skin alone, then we just say this is an allergic reaction. But if the patient comes in with skin plus a finding from another system, okay, so you have two systems involved, okay, to say that this is a anaphylaxis. So if it's skin, it has to be either together with your lungs, which is bronchi, wheezing, or if it's skin together with GI, patient has nausea or vomiting or itchy sensation of the throat, or if the patient has skin plus cardiovascular, which means patient has a drop of blood pressure, okay, postural changes, hypotension, drop of blood pressure, okay, giddiness, whatever that can say that there is reduced circulation, reduced perfusion to the brain as well. So that's the first criteria for WAO, which is skin plus either lung, skin plus GI, or skin plus cardiovascular. That's the first definition. The second definition is they can either have 2 of these systems together, regardless if they have skin or not. What I mean by here is that they may have skin and lungs, or sometimes they may have only GI and cardiovascular, or sometimes they may have lungs and GI. So skin itself alone is not a criteria for anaphylaxis. Sometimes you can get anaphylaxis without the involvement of skin. 2 systems, as long 2 systems are involved, it is already considered anaphylaxis. Patient should get treatment. Okay, so either skin or lung plus GI, or GI plus cardiovascular, or cardiovascular plus skin, either 2 is already enough to say that this is anaphylaxis. So that's the second criteria. The third criteria is patient has nothing else except for a cardiovascular change, meaning the patient has drop in BP, all right, after an exposure to a known allergen. Patient just has drop of BP. That's it. No skin, no lung, nothing, just a drop of BP. The shock itself can be contributed to the patient being exposed to a known allergen. Okay, just a drop in BP alone. So these are the three criteria in your for your WAO recognition of anaphylaxis. Why? The moment when somebody comes in with anaphylaxis, we need to resuscitate them, especially in this patient, anaphylactic shock. So remember, when you come to resuscitation, it's always airway, breathing, circulation. Okay, airway, breathing, and circulation. So number one, look at the first option. The first option is IV adrenaline 1 in 100,000, which is correct, because what you do is you take out 1 cc. Okay, you take out 1 cc from your 1 in 1000 adrenaline, the pure 1 cc, and then you dilute that 1 cc into 10 mils. Okay, into 10 mils of water, and you can start running a infusion into this patient 1 in 100,000. Okay, or simply what we sometimes do, we take 3 ampules of adrenaline. Okay, 1 mil ampules. We take 3 mils, dilute into 50 cc of normal saline, and we run 2 to 10 mils per hour. Okay, so we start a IV adrenaline infusion, which is correct. Why? Because adrenaline is a medium chain inotrope. Compared to noradrenaline is short chain, adrenaline is medium chain, and a long chain what we call it, symptomatic such as salbutamol is long chain for beta 2. Okay, primarily the blood vessel is alpha 1, the heart is beta 1, and the lungs is beta 2. Why we prefer to give adrenaline? Because adrenaline is medium chain. So medium chain works well on the vessels and also the lungs. Okay. So what happens is that this adrenaline will act on the alpha receptors, alpha 1 receptors, causes vasoconstriction of the peripheral vessels and deliver blood back into the heart. Okay. At the same time, that adrenaline will also work on the beta 2 and increase the contractility of the heart and increase the cardiac output to the circulation to the other cells. At the same time, because of its effect on beta 2, adrenaline works on the lungs to cause smooth muscle relaxation, okay, and reduces the angioedema and clears the respiratory airways. So that is why adrenaline is very superior in this case. The moment somebody has anaphylaxis, you need to give them adrenaline. The choice of how you deliver the adrenaline depends on the condition. If it's anaphylaxis, not shock, we tend to give 0.3 to 0.5 cc of adrenaline into the buttocks, okay, into the muscle, give an IM injection, and the body will react to the adrenaline. In anaphylactic shock, we do not give IM injections, because IM injections, because of the poor vasculature, because the patient is in shock, the muscles are not well perfused. So even if you give IM, this adrenaline will not be able to circulate properly. So that is why in anaphylactic shock we give IV adrenaline, but not pure though, because pure can cause the patient to go into a cardiovascular event. Pure adrenaline is too dangerous. It can even precipitate acute coronary syndrome or myocardial ischemia. So that is why we need to dilute it and run it as an infusion. Okay. The next option is IV hydrocortisone. Yes, in allergic reactions or anaphylaxis, very commonly we give IV hydrocortisone and IV Piriton. But remember here, the management that we wanted was immediate management, meaning that what are the measures you take for the resusc and stabilization. Remember, in your principles of management, number one is resuscitation and stabilization. Number two is establish diagnosis and focus investigation. All right. Number three is your treatment. So treatment comes much later after your resusc and stabilize. Okay. IV hydrocortisone and IV Piriton are actually what we call as treatment for anaphylaxis, not a drug that we use in the resusc and stabilize. Yes, we can give it immediately when patient comes, but please do remember they are treatment for anaphylaxis, but they are not actually drugs that are used to resusc and stabilize. Resusc and stabilize are the drugs that bring the patient out of the life-threatening condition. So in that sense, IV adrenaline is the one that is considered the drug in resusc and stabilize. You need to find some other management that is more related to resusc and stabilization. Hydrocortisone and Piriton is not under the resusc and stabilize criteria, the immediate life-threatening management criteria. Okay, so this is where a lot of students actually can make mistakes as well. All right. Continuous monitoring of BP, heart rate, and SpO2. Yes, this is correct. Because patient is in shock. So as you're giving your treatment, you need to know whether is your treatment working, is your adrenaline working, is your fluids working. So you need to see whether the blood pressure goes up, whether the heart rate is, if the patient is becoming less tachycardic, is the SpO2 improving after you give. Because if there is no improvement, you may need to consider to add inotropes. If there's no improvement to the airway, you may need to consider to secure the airway, okay, via intubation or cricothyroidotomy. So it's very important that you need to continuously monitor the patient's BP, heart rate, and SpO2. Nebulized salbutamol. Okay, nebulized salbutamol is correct to a certain extent because when you give salbutamol, it works on the beta-2 receptors, so you can cause airway relief. But salbutamol does not have effect on the heart and on the peripheral vessels. Okay, maybe in very, very high doses, but that's it. Nebulized salbutamol is not the standard therapy. It's not the standard treatment because it only covers one system. You need a drug that covers all three systems. Okay, your lungs, your heart, and your peripheral vessels, which is your alpha 1, beta 1, and beta 2. Adrenaline does a superb job of covering all of these three receptors. Okay. Then you have IV drip, normal saline maintenance. This is more of your steps in treatment of the patient, not for resusc and stabilization. Remember, in this question was immediate management, means it's pointing towards resusc and stabilization. Intubate the patient. Well, for this patient, it's definitely not indicated for intubation yet. You still want to give the drugs, okay? Your adrenaline, you want to give oxygen, you want to prop up the patient, give fluid, and see how the patient responds. If the patient responds well, then you don't even need to intubate. But if the patient does not show any response, SpO2 keeps dropping, patient is having more and more respiratory distress, hypoxia, then you got no choice. You need to intubate, of course, with the help of anesthesiology, because this is going to be a difficult airway. Remember, when there's difficult airway, you need to prepare for difficult airway, and most important thing is call for help when you predict there's going to be a airway difficulty. Prepare for cricothyroidotomy, obviously, is the last choice. When you try to intubate, you can't do it. There's too much of airway edema and swelling, laryngeal edema. Then you got no choice. You need to put your, you need to do a cricothyroidotomy. Put patient on 100% oxygen via high flow mask. Yes, this is correct. You need to prop up, give 100% oxygen, and try to improve the oxygenation as much as possible. Refer to ENT team and refer to medical team is correct. ENT, if you're having airway difficulties, medical team for the management of the anaphylaxis. But remember, this is not an immediate management. This is a management that you will be doing after you have stabilized him. Your job, our job, is to stabilize this patient, to make sure that this patient has got a fighting chance and survive for subsequent management. Okay. Run normal saline bolus at 20 ml per kilogram is correct. Because when patient comes in shock, although we treat for anaphylaxis, which is we give adrenaline, at the same time, we also give fluid. Because remember, fluid will also increase the intravascular volume, increase the cardiac output as well, via your Frank-Starling's law. Okay. So because of that, whenever patient comes in anaphylaxis, we still give fluid, bolus, and then immediately we also give the other drugs to improve the circulation as well. Okay. Okay, so with that, we have come to the end of our question. I hope most of all would have got full 10 marks for the KFQ question. But if you don't get 10 marks, it's okay. We always learn from mistakes. Okay, so it is good to make mistakes now. We learn. Okay, and hopefully when your exams come, or even when you manage a patient like this, you know exactly how to manage this patient. So with that, we will continue tomorrow. We'll do another KFQ question. So please stay safe, guys. Protect yourself. Okay. Protect your loved ones, and hopefully all of us will work together hand in hand to prevent this, to make sure that we get through this pandemic together safe and sound. Thank you everyone. Take care. Bye bye.